Hi, my name is Dr. Chinitz and I'm a psychologist at the South Bronx Health Center. In this video, we will provide a general overview of the ACEs model. We'll demonstrate how to introduce the ACEs questionnaire to a parent and how to discuss results and follow-up after the parent has completed the questionnaire. ACEs stands for Adverse Childhood Experiences. These stressful events, or ACEs, can include child abuse, neglect, growing up with a parent who has a mental illness or a substance abuse problem, exposure to domestic violence, the death of a parent, and more. As the amount of stressors increases, the risk for negative health outcomes increases. Studies have shown that the more stressful events you experience as a child, the more likely you are to have long-term physical and mental health problems as an adult. These problems can include diabetes and high blood pressure, heart disease, depression and anxiety, substance abuse, and even suicidality. The ACEs questionnaire is typically made up of 10 yes or no questions about difficult childhood experiences. If the patient is a child below the age of 18, you could administer the ACEs self-reported questionnaire to the parent, perhaps at the annual physical. Adults over 18 only need to complete the scale once over their lifetime, since the questionnaire asks about experiences in their first 18 years of life. Even if the parent isn't your patient, it can still be useful to have the parents of children complete an ACEs questionnaire for themselves. This is because we know that adverse childhood experiences can often affect parenting as well, which of course can impact a child's well-being. It might seem overwhelming to go through intense personal questions with a patient, especially if you have limited time during your visit. If you're not a mental health professional, you can also ask the parent to fill out the ACEs screener in written form. Talk with the parent to reassure them about any concerns they might have about completing the questionnaire. It's also really important to stress that answering the questionnaire is completely optional, as often in traumatic experiences, there's a loss of control. It might even be useful to provide a cover letter along with the ACEs screener to explain its purpose. Sample cover letters and ACEs screeners are included below. You can use these as templates. It's important to allow the parent to complete the ACEs screen in a private area so that they can feel safe and secure. The total score is calculated based on how many times the parent answers yes to the questions. If the score is 4 or more, it indicates that there's a need for follow-up. You can provide mental health or other therapeutic referrals as needed for those with a score of 4 or higher, or with patients who become distressed when completing the questionnaire. Remember that it is the number of different types of traumatic experiences that's scored with the ACEs, not the severity of any one experience. The research tells us that it is the experience of multiple stressors that greatly increases the risk of long-term health problems.